Dr. V, can my sleep apnea condition increase my risk for gum disease?
The short answer is absolutely yes. There are not just the sleep apnea. There is a variety of inflammatory conditions, and we have in my class that I teach, like there are, like, even to the dentist. Sometimes I do teach a lot of class to my referring dentists, even to let them be aware. We got a variety of diseases. I have a list of about 60 diseases. Those are inflammatory diseases. They're all connected. So sleep apnea is one of them, which is an inflammatory disease, and the gum disease is another one of them, which is an inflammatory disease. So any inflammatory diseases are connected. For example, sleep apnea can worsen your gum disease, or your gum disease can worsen your sleep apnea. It is a two-way street. One of the common things what we see in sleep apnea patients is they kind of sometimes or most of the time breathe through their mouth, and when they breathe through the mouth or when they snore, and it causes dryness in the mouth. So when you have dryness, and that cannot flush all the bacteria that are supposed to be in the mouth, and when it does not, the body does not flush the bacteria tend to stay. Now they cause more inflammation and then more gum disease, and because your mouth is dry, and now you're more prone for inflammation and more prone for gum disease also. Again, the bottom line is whether if you have sleep apnea, then you need to check with your dentist what is your inflammatory status of your gums, and whether you need extra gum treatment as opposed to a patient who does not have sleep apnea. And then one of the most common things that I recommend for those patients is, if a regular patient gets their what we call it as scaling and root planing or a deep gum therapy gets done every 3 to 5 years, you may be in the shorter end of the spectrum. You will need to have the deep gum therapy done maybe every 2 to 3 years. And if a regular patient is getting a regular maintenance cleaning done every 6 months, then you having particularly either gum disease or you're more prone for gum disease, my recommendation is you get the cleanings done every 3 months, not every 6 months. So inflammation needs more TLC, tender loving care. Check with your dentist and make sure that the sleep apnea is corrected as well as your gum disease is corrected.